Good evening and welcome to all of you. I'm Rebecca Stoner, Head of Professional Affairs here in the UK and Ireland for Alcon. This is my first time hosting the Alconversation and I'm very much looking forward to discussing with our esteemed panel this evening. The Alconversation provides a forum in which we can explore some of the bigger themes experienced by practices over the last year. The discussion will be navigated through the use of questions we've received from practitioners and practices across the country, and a couple from our optical press too. Thank you to all of you who have contributed questions, and I'm sorry that we may not be able to use them all. The forum is also a progressive environment where what we don't want to do is point the finger or blame or moan about it. We ask that our panel reflect upon what we can learn from the situation or experience and how we can grow stronger or better for it in the future. Ultimately, this should be focused upon how we can be better for our patients, our practice, our peers, but of course ourselves. Before I introduce our chair, a familiar face to many of you who will be introducing our panel, I would like to invite those of you viewing live, not on demand, to be part of the discussion. You will see a chat function on the screen that will allow you to share your thoughts and your questions with us here in the studio. Sadly, we will not be able to share all of them, but we will do our best to let your voice be heard this evening. So it's now that time for us to formally commence this evening's proceedings. I'm delighted to welcome back to his chairperson seat Mr. Richard Edwards. Richard has been an important part of my own professional development and an equally important part of our conversation. The reason he is the right man for the job tonight needs no justification, but to provide you with some reassurance, he is, amongst other things, a previous professional service director for a large retail chain of opticians, a consultant to the GOC and FODO, plus the clinical lead at the Optical Consumer Complaints Service, and he's a proper decent chap too. So Richard, over to you.
Thank you for that introduction, Rebecca. Well, look, everybody, welcome. It's lovely to have you all with us this evening. I hope everybody is safe and warm at home in this dreadful kind of weather that's landed on us this evening. I'm like Rebecca, I'm really looking forward to this evening's conversation. We've got a fantastic panel who I'm now going to ask each of the panel in turn to introduce themselves to you. So first of all, Leonie.
Thank you very much, Richard, and good evening, everybody. My name is Leonie Milliner. Some of you may know me. I'm the Director of Education at the General Optical Council, a position I've been in for just under 2 years. So we may well have crossed paths in some of the work that we've been doing to introduce some broad scale changes to the qualifications that we approve. And in January, I step up into the role as Chief Executive here at the GOC.
Thanks, Leonie, and congratulations on the appointment. Absolutely.
That's very kind of you, Richard. Thank you.
Thrilled with that. Fantastic. Alistair.
Thanks, Richard. I'm Alistair Bridge. I'm the Head of Strategy at ABDO, the Association of British Dispensing Opticians. So we're the professional body for dispensing opticians and contact lens opticians in the UK. So thanks for having me this evening.
Oh, thanks, Alistair. Good to have you back. Colin.
Thanks, Richard, and thanks to Alcon for the invitation this evening. I'm Colin Davidson. I'm president of the College of Optometrists. It's a great pleasure to be here. Outside of my college role, I also work for the University of Hertfordshire, where I'm a programme lead for higher qualifications, and I do work 1 day a week in hospital practice. So it's good to be here this evening.
Thanks, Colin. Great to see you again. And a regular at these events, finally, Peter. Hi, Peter. Do you want to introduce yourself?
Good evening, Richard. Thank you. So I'm Peter Hampson. I'm the Clinical Director at the Association of Optometrists and another returning panel member. So good to be back. I obviously didn't say anything too controversial last time.
Thanks for your look. And again, it's just great to have, viewpoints from all of the key opinion leaders and key professional bodies in the profession. So I think we're well set. Rebecca, can you give us the first question, please?
Of course. So the first question has been asked by an optometrist in Nottingham. Tele-optometry has become a more established part of the practice toolkit over the last 18 months, but some practice seem to be keen or accepting that they want to go back to how things were. So do you think that tele-optometry should become a more established or embedded part of everyday practice, and what needs to be true for this?
Okay, so tele-optometry, one of the things that's emerged from the pandemic. First of all, Leonie, what are your thoughts on this development?
Thank you ever so much, Richard. Well, first of all, of course, we at the General Optical Council are the statutory regulator. And we, as many of you will know, regulate two professions, optometrists and dispensing opticians, as well as some optical businesses. And as a statutory regulator and as a registered charity, our aim is to protect the public. So looking very much at this question through that lens in relation to sort of protecting and benefiting the public, and looking at the future, which is racing towards us at a race of knots. Optical care should, of course, be delivered according to patient need. Some patients will welcome new technology. It may well be more convenient for them. It may allow a more accurate diagnosis, for example, or some patients may just enjoy engaging with new technology. But other patients, and I think we all need to be cognizant of this, other patients will still wish to have that sort of human interaction. And that's likely to be particularly important for vulnerable patients, for the elderly, and for children, for example. And so the headline is very much that technology in whatever form will continue to develop and be incorporated into optical practice. However, the standards for patient safety must be maintained. And of course, our statutory responsibility is discharged mainly through those two really important documents, the standards for optometrists and dispensing opticians and our standards for businesses. And our role as the statutory regulator is to make sure that we don't create any unnecessary regulatory barriers that prevents businesses incorporating or taking advantage of technology, and that the registrants and the businesses we regulate are equipped and that they're supported to apply their professional judgment in order to comply with the legislation, in our case, the Opticians Act, and also those two vital documents, those standards for optometrists and dispensing opticians and those standards for businesses.
Thanks, Leonie. I'm glad you went into the standards bit, because I think they are, that's something that all registrants should be really, really cognizant of, because it sets out the framework, doesn't it? When we all prevaricate and worry about, how do I do things? How should, what are the guardrails in which I act? Actually, they are, a really, really good kind of route map to help us steer our way to understand what we should and shouldn't be doing. Alistair, what's the Abdo take on these developments in the last 18 months?
Well, thanks, Richard. I think, first of all, I would echo a lot of what Leonie said. I think whether tele-optometry does become more embedded in practice will really depend on what patients want. And many will prefer to see a practitioner face-to-face. Some will prefer a virtual appointment. For example, if they want advice and guidance, if they have a minor eye condition. And I think that could be a particular value for patients living in more remote or rural areas. So I think we will continue to see some practices offering virtual appointments, really building on the use of virtual triage during the pandemic. But it is really important that is safe, that eye care is delivered safely, and that means practitioners and other staff need to be properly trained. They need to have the right technology and the right processes. And I think also, this is very much linked to the standards, the ability to be able to store images for future reference, and also so they can be transferred on to other colleagues for onward care, where that's appropriate. So yes, I think we will continue to see tele-optometry, but I think we're looking to the future. We're trying to anticipate how things might develop. We should also look, I think, at look beyond how practices can use tele-optometry and the way in which we might see online platforms looking to deliver a whole range of tele-optometry services, and that creates challenges for regulation, particularly where companies are based overseas, and also practices will need to respond to that. So it's useful to try to understand why patients are attracted to online services, and I think in response we like to see technology more embedded in the way that practices treat patients. So that's partly about virtual appointments, but also other services. So it might mean enabling virtual try-on of frames before a patient even comes into a practice. So I think there are lots of ways in which tele-optometry will shape the future, both being used directly by practices and also the way in which it will be used online, and as a result, practices and practitioners will need to respond to that.
Thanks, Elsa. Yeah, you can't help but feel we're at the beginning of something much bigger, isn't it? This is almost the first wave of the technological revolution that's going to wash over our professions in the coming years. Colin, what's the college take on these developments?
Yeah, thanks, Richard. And I guess we would be fairly aligned with what Leonie and Alistair have already said, that, you know, it's going to be a bit of a mix, isn't it, really? I suppose if we reflect back to the sort of the start of the pandemic, and really it restricted patients' ability to access any kind of healthcare on a face-to-face basis, and as optometrists and optical practices, we were really restricted with what we could do with social distancing. So it was, I think, you know, invaluable in the early stages in accessing patients who needed urgent care and attention, which I think was really great. And I think, you know, the college were really keen to issue guidance on how practitioners should run these kind of tele-optometry services, to make sure they were aligning with the standards, which has already been mentioned as well. But I think, you know, as we look at how businesses are returning, you know, not just optometry, there's a hybrid, isn't there? And I guess there's going to be a bit of a hybrid as well with tele-optometry. I think there'll be some practices and some patients that will like it, but there'll be some practices and some patients that won't like it. And I think it's probably been alluded to already. You don't want to exclude maybe people who have not got the access to technology and would therefore miss out on various services as well. But you know, I'm just thinking that particularly for some patients who have got acute problems, the value of face-to-face consultation, particularly with an IP optometrist, I think you know, that would be something that would be much better carried out on a face-to-face basis. But somebody that wears a contact lens one day a week and you just need to touch base from time to time, a quick telephone call might work quite well in that respect. So I think it's really important that you know, practices are flexible in the approach. I suppose the one thing I'm thinking of as you know, if I was a customer at an optical practice paying a set fee per month for professional fees, I would probably still want to go and see my practitioner if I was paying a direct debit every month on that. But you know, I think you've got to take some and some. But the college, you know, we're like Alistair's already alluded to, we're thinking about what does the future hold, how might these things impact on our scope of practice as it changes. So you know, as part of our ongoing strategy, we'll be looking at ways that we can support good practice in future.
Thanks, Colin. And Peter, what's your take with an association perspective on these changes?
Thanks, Richard. Yeah, it's an interesting one, isn't it? I think people have talked about a number of the things that we are thinking about. What the future holds, what will it look like, where should it fit? And I think teleoptometry has a really important place, used correctly, but it needs to be used by practitioners and not be sort of used almost against practitioners. So it's a tool for practitioners to make use of to deliver care in an appropriate manner to the patients that need it, so that patients that don't need face-to-face don't take up appointment times that could be better used for patients that do need face-to-face. I think that's really important. I think it's really important that we don't just do things for the sake of doing them as well, though, that we don't just say, well, we can do things by teleoptometry, therefore we should. That's the wrong reason for doing it. What's the justification for doing it? And we have to be mindful and cognizant that, as others have already touched on, that people don't come in and exploit it and take advantage of and actually lower the standard of care, deliver a worse experience to patients, and then put them in a more difficult position than if they'd have got that face-to-face care where it would have been appropriate. Because that's not in anybody's interest if the patients aren't actually getting the same level of service just so that we can say that we're using technology. That wouldn't be a good position in my view.
Yeah, I guess interesting listening to the four of you all speak, what I'm drawing out of is a real kind of encouragement for the profession to embrace and own this technological change, because if we own it, then we shape it in an appropriate way. I also have to say, I think the thing that struck me that's really reassuring is we've all talked about being led by the consumer. And I think that's one of the things that optometry as a profession has learned to do and is nimble to, and I think that that's come out of this. The second part of that question talked a little bit about kind of what needs to be true. So I suppose there's a couple of things for me in this. I guess Leonie, I don't want to put you on the spot, but I guess you must have some thoughts about, I guess, the Opticians Act. Was written in the 50s. It was tweaked in 1989. We all moan about it, being a bit kind of retrospective. What are your thoughts about how do we move within the constraints of that, or is it, are we getting close to the point where, it is no longer fit for purpose? What are your thoughts on that?
So you're right, Richard. I mean, the Opticians Act was written in an age when I don't think any of us on this call probably had an email address or had access the internet, and so the world and technology has moved on, but legislation in general is designed to be enacted well in the circumstances that we find ourselves in at the moment. And certainly we're planning on having a call for evidence in the new year to sort of look for evidence from across the sector on how our Act should be updated. And of course, we also know that Department for Health is considering a programme of legislative change. So I think, the moment is right to ask some of those bigger questions about the nature of our Act and whether it's fit for purpose and whether it describes, the contemporary environment that our registrants find themselves in at the moment. Having said that, it is our responsibility to work within the Act at the moment, and certainly there have been and there will continue to be challenging circumstances, COVID being one, which makes us go look very closely at the Act and the specifics, probably in a way that was never anticipated when it was first drafted. So I think 2022 is going to be a really interesting year, and one of the things that's going to make it really interesting is this call for evidence, and to consider how and when we might reframe those statutory obligations.
Fantastic, thanks, Leonie. Rebecca, I think you've got another question from the audience.
So it's not a question; it's actually a statement, but it kind of sums up kind of what our audience probably are thinking, and it is so important for practitioners to be allowed to exercise their professional judgment, and that we should feel empowered to do that. And I think
absolutely. I think, and actually going back to the Leonie, you mentioned the practice standards. I think they are an empowering and enabling set of statements. Really, if you operate within that, but it does give you a bit of elbow room.
Absolutely, Richard, and I think one of the sort of oft-repeated statements across healthcare regulators is that documents that describe, if you like, your commonly held ethical standards as a practicing professional are not dry documents that sit on a shelf that you refer to occasionally. They're working documents that you have beside you that guide and inform the application of that professional judgment from patient to patient, from day to day, week to week, year to year. And coming back to that, the original point, which is about regulatory reform, one of the sort of underpinning principles moving forward is to ensure that whatever our legislation is, it's future-proofed, so that we have adequate powers to regulate the delivery of optical services given the unknown, given future developments in technology, and that we regulate in a manner that's proportionate.
Yeah, and I think the other thing for me, which I guess is personal to me, given the job my day job, if you like, at the Optical Consumer Complaint Service, is I think it's appropriate to pay tribute to some of the work that Dion and the team are doing in fitness to practice at the GOC, which is really becoming transformed. And I know lots of people watching this at home, kind of live in fear of the GOC, and I just think the work that's been done, and I just please ask people to look at some of the data and stats that are now coming out, that the work that GOC are doing to really only limit their investigations into things that, really justify it. It hasn't always felt like that as an optometrist, but I think that feels as if it's coming just at the right time, because if we're going to step forward and liberate the profession to embrace the new technology, this couldn't have come a moment at a more appropriate moment, really. So I think, credit to Dion and the team, because they are really transforming that. I'm going to move to the second question because it kind of plays from the first. So Rebecca, what's our second question?
So this has been asked by a practice owner in North London. So COVID provided an opportunity for many other innovations in practice ways of working. We touched on this last year, but a year on, what do we think should be kept and or developed further?
So it kind of almost broadens us out from the narrow focus on kind of tele-optometry. I guess COVID is one thing, but also just the rate at which technology is developing. There's a lot of stuff changed. What do we think we want to keep? Alistair, I'll come to you first on this one, if that's okay.
Yeah, thank you, Richard. Well, I think the main thing we should keep, and not just keep, but really embrace, is the idea of dispensing opticians and optometrists operating at the top of their license. So, using the full range of knowledge and skills which they have for the benefit of patients. And I know that's something that many practitioners have done throughout the pandemic and has been of real benefit. So I think that's the main point I'd like to emphasize. I think in addition, I think the standards for infection prevention and control have encouraged higher standards of hygiene within practices, definitely to be welcomed, and really seeking to ensure consistency across the board. And as we've discussed, there is likely to be a place for virtual appointments in the future, particularly triaging patients with minor eye conditions. And I think that's a really good way of making emergency care much more accessible, particularly given the pressure there are on accident and emergency departments. I think one note of caution, I think we should be wary of virtual appointments becoming the norm when it comes to contact lens aftercare. I think what's appropriate for a patient should be driven by the practitioner's view of what's in the patient's best interests. Coming back to the idea of allowing practitioners to use their professional judgment, and particularly for new contact lens wearers, a phone call to check on how they're getting on isn't likely to be appropriate. Probably an extreme example, but that's the case where it's going to be really important to examine the patient and see that lenses are being worn safely. So I think overall more hybrid working, which I think will be good in enabling practitioners to meet the diverse needs of their patients. And as I said at the outset, I think really, really good if we can maintain this idea of practitioners really being able to use the full range of skills and knowledge that they have, and be encouraged to develop those skills too.
Yeah, and that top of the license comment that you made, I'm going to come back to that if I may in a moment, because I think that encapsulates one of the things that we need the profession to kind of embrace. Colin, what are your thoughts on what do we want to keep?
Yeah, thanks, Richard. And I guess following on from what Alistair said, optimizing all available skills across eye health professionals, just to ensure that we've got good trust between primary and secondary care in delivering whatever the new models of care might look like in the future. The pandemic, we would all agree, has put a huge strain on us in the optical profession. It's been really difficult and really, really, really challenging. But I think there's been an acceleration, hasn't there, in the development of pathways and policies that, if we think back, would have been snail's pace before. So things have come on a pace, really. And I think the collaboration between primary care and secondary care is growing. Maybe better in some regions than others, but there's no doubt that it's improving. And I think really what we would do would be to champion the role of the optometrists in really contributing to the essential kind of urgent care that we've been able to provide. And I think primary care practices are really well placed to provide enhanced and shared care services close to patients' home, alleviate the pressure on hospital eye services, and really try and reduce the backlog of patients that are waiting for appointments. So, we don't want to go back to the status quo that we had before. I think we would really want to see things that eye health is high on the agenda of commissioners as we move into new ICSs, and really that the skills of eye care practitioners in primary care are recognised as part of that, so that we provide services that are trusted by the public as well. And as things develop over the next year, and hopefully the new models of care come into being, we will be driving workforce development and helping with workforce challenges.
Yeah, I mean, I think one of the things that's interesting is, having done the Alconversation, we've touched on this subject of moving to top of license. And when we started this event some years ago, it was a kind of almost not so much a nice to do, but an aspirational thing. I think what COVID's done is shifted that to it's absolutely essential for the eye health of the nation now, because the game's changed. I mean, you look at any of the data in terms of the future projections for chronic eye disease in UK society for the next 20 years. You look at the ophthalmological workforce challenges in the next 20 years. There's two lines going in opposite directions, and there's a whole host of work in the middle of that we're going to have to fill. So I think that the fact is, society needs us to step into that space pretty damn quick. How we get there and how we fund that, I think, could be a whole debate on its own. But I think that gap is opening up, and we just, there is no option. We're gonna have to be the people to close that gap. Peter, from an association perspective.
So I think the thing for me, and I think we touched on it last year, is we've moved away from database-driven examinations. We've gone to problem-orientated examinations. And that's what most of us were taught, and that's how most of us left university thinking we were going to practice. And a lot of us dropped into very much, we must do X, we must do Y, and then that's the sight test. And what this period has taught us is that actually you address the problem and you don't do superfluous tests just to say you've done them if they're not clinically indicated. I think that's a really big and important thing that we need to keep. From a working at the top of our license perspective, I think I differ a little in that I think it's easy to malign core competence and malign the skills that our colleagues have. And they are very, very well skilled and very well trained. We're just not utilising it in a lot of instances. And we've done some work with the college and with Abdo and with LOXU and all sorts of people to put together a matrix that shows what practitioners can do without doing additional qualifications. And that's not to say those additional qualifications aren't important. But again, it's just important that when people achieve those, they've got a proper dedicated use for them. And they're not dabbling, just having a go now and again, that they're actually using the things that they're very good at all day. And for optometrists and for dispensing opticians, there's a lot in those boxes. We're just not really utilising it as fully as we could at the moment. So that would be my wish. But I think the problem-orientated exam is absolutely what I would like us to keep.
Yeah, and actually building on that, I suppose one of the things that is coming up fast on the rails for us is use of artificial intelligence. And how we as a profession embrace that. So we may touch on that as the evening goes on, but that is kind of game changing in terms of enabling us to be confident in getting data, and then we interpret that. So Leonie, thoughts from a GOC perspective in terms of what you'd like to see staying?
Gosh, thank you, Richard. And how exciting as a profession to have a gap to fill. And, what an extraordinary set of circumstances that we find ourselves in. COVID has certainly accelerated change, hasn't it? It's accelerated change across our civic landscape, in the way consumers behave, in our adoption of technology formats like this evening. Yeah. It's accelerated change in education, in particular in higher education, in its delivery and in the workplace, and of course in the delivery of healthcare. And that change has accelerated in a way that we never could have anticipated if we were sat here sort of 2-3 years ago. And there are several aspects to this. The first is that GOC as a business has been impacted in the same way as other businesses, and the way that we as a regulator have engaged with stakeholders, the way our governance has embraced remote working, and the way we've managed risks to patient and public safety that have been created by the pandemic and flexed our sort of regulatory operations and strategy accordingly has been a real challenge that we've absolutely relished over the last sort of 18 months or so. And I think when it comes to that sort of issue about filling the gap and working to the top of our license, although actually I have a degree of discomfort with that particular phrase, but I understand the intention that sits behind it. In education in particular, we've seen that acceleration in innovative means of delivery that, again, we couldn't have anticipated. And that's really sharpened a debate more broadly about, for example, value for money in higher education and in non-medical healthcare, in particular exposure to that breadth of clinical experience that students might have had in more traditional ways pre-COVID and has now gained far more differently and innovatively now. And these are all sort of really granular issues that we'll need to work through in optics. And I think the question was about COVID has provided us with innovative ways of working. What do you think might be kept and what might be developed further? Well, what we've seen in the delivery of qualifications that we approve, which is generally in the higher education sector, but also in the further education sector, we've seen huge innovation, particularly around curriculum design and assessment, in supervision of students. And a lot of those innovations were introduced very rapidly in order basically to keep the show on the road. But actually, they're here to stay, aren't they? They're here to stay. And so I think, what a crisis gives us is a great opportunity to pull together. And that's what we've done. And I think the sector needs to be very proud of itself for pulling together. And now is the right time. Pandemic, hopefully at some point moving to an endemic situation, to consider how we've pulled together and to replicate that in terms of moving forward, to embedding and continuing to accelerate some of those changes. And I think the final opportunity, if you like, that I'd like to highlight that's been created as a result of COVID is around interprofessional learning, and the value of interprofessional learning and multidisciplinary team working is around sort of the benefits that can bring to patients and the public, particularly around service redesign, and being able to evidence to other professions, to commissioners and to influential stakeholders the contribution that our sector can make within that broader sort of service design piece that we're working through at the moment.
Yeah, and I think for me one of the remarkable examples of the profession and the various components of our professions working really well in the last year was, if I can imagine it from Colin's perspective at the college, when suddenly you've got a pre-reg program and 600 students in the middle of a pandemic, and you're thinking, how do we get 600 people through the PQEs? And here we are. We couldn't have talked about this 12 months ago because it was live, but here we are, and the pre-reg system worked. And that was a remarkable example of the whole industry, everybody involved in pre-regs, just tweaking what they did to make sure the thing stayed on the rails. And lo and behold, it worked. And that was phenomenal, because I think when the pandemic dropped, those people involved in pre-reg world were probably terrified, because how on earth were we ever going to get through it? It's not surprisingly, we've got a question from the audience, which I'm going to read out, which is, how will the panel support our adoption of artificial intelligence technologies in our practices? So it was, I guess it's the year when this stuff started to emerge. It wasn't a surprise that it popped up on the radar for the audience. Again, we'll just stay in the order we've just been in. So we'll, Alistair, artificial intelligence thoughts?
I think more generally, ABDO is very keen to support our members in embracing new equipment that can be used within practices. And an example of that is the training we're providing for members in relation to OCTs, something we've launched recently. And I think artificial intelligence will have a role to play. And I think Peter touched on the fact that it will provide more information, more data for practitioners to then use to inform their judgments. And so I think we would certainly see our role as being able to support members, individual practitioners, and also practice owners to use this technology, enable their staff to use it to better serve patients.
Yep. And Colin?
Yeah, Richard, I think it's about support and guidance. Practitioners have got to feel confident in using the new technology, interpreting the new technology, making sure they're doing it to the best of their ability for their patients, so the patients are well looked after, and having good guidance in place as to how to use it and integrate it into their practice. Because with our crystal balls and looking into the future, it's going to become more and more a part of what we do in our day-to-day practice. I think so. Our role, I think, at the college would be supporting and guiding our members through that to integrate it into the practice for the best for everybody, really.
And Peter, association perspective on what are we going to do to support your membership to adopt AI technologies into their workplace?
I mean, I think what's really important is, and we touched on it before, and Alistair just called it back, it's using technology, not being used by technology. And then it's very clear demarcations over where responsibility lies. Is it a product that informs your decision making and aids you to make a better decision? Or is it removing your decision making and you're relying solely on it? And in the latter, that sets a dangerous precedent for the profession and the future of the profession. But if that's the way it does go, then we need very clear rules on where liability sits. So if something does go wrong, is it the practitioner or is it the product that is ultimately liable for the mistake that's been made? And that's where we will be really paying attention and really focusing efforts to make sure those lines and those processes are very, very clear, so people aren't put at undue risk.
Yeah, no, absolutely. And Leonie, I guess from a regulatory perspective, what do you see the GOC's role in encouraging people to embrace AI?
Well, first of all, as the answers that we've just heard illustrate, professional bodies, membership associations have a critical role here in supporting members, registrants in the safe application of any technology which might emerge. And of course, we have reference to artificial intelligence and technological innovations within our standards, and our expectations there are quite clear that when introducing new technology or when using AI, registrants must make sure that doesn't compromise patient care and that our professional standards continue to be met.
Yeah, absolutely. It's an interesting one. If I can use a motoring analogy, for me, it's like if AI was used in a positive way, it would be almost like the traction control button on the car. You wouldn't willingly switch it off. I can imagine a world where we get to OCTs and retinal photography with artificial intelligence, where the AI program is your traction control button. It's going to keep you out of trouble, as it were. But equally, what we don't want it to become is a bit like the sat-nav, where we forget how to navigate because we become so dependent on the sat-nav, don't we? And mea culpa here. I'm dreadful without sat-nav, where I used to be pretty good at finding my way around the country back in the day. Okay, we're going to move on to the third question, which I think comes from Optometry Today. So, Rebecca, who sent the third question?
Yes, so Emily McCormack from Optometry Today has asked, as more independents have turned or are considering turning private, what does this mean for the profession, the GOS, and access to eye care for patients?
Interesting. So the kind of move to exclusive private practice only. Colin, what are your thoughts on this?
Yeah, thanks, Richard. Great question and a really topical question. I think, particularly with some of the recent conferences we've seen, where it's been a hot topic, really, hasn't it? Mm-hmm. We all understand that most practices at the minute have got a mix of NHS and private, and the majority are mainly NHS funded, but it's an administrative burden, isn't it? Particularly with the low GOS fees that are in offer, particularly in England, and I can see why some practices have considered this as a route to go down. But on the flip side, there are some practitioners who think that the pandemic really has created an opportunity for the profession to highlight its value to the NHS and particularly to capitalise on the urgent need to alleviate pressure on secondary care at the moment. And I think as well, there's also the sort of the extension of these care services in primary care and working with our colleagues in ophthalmology. I think as a college, what we would want to see is high quality eye examinations available to all, including NHS patients, and really we wouldn't want to see patients who have got greatest need being excluded because they haven't got an NHS provider that they can find locally. I think it probably comes back to what we've touched upon earlier. Really, we want to encourage commissioners to see the value of primary eye care and look at how our NHS eye care services are delivered, and really utilise our highly skilled workforce that we've already been talking about. So we're working really hard with the national health systems to ensure that eye care is improved, and that's really where we would like to see things going.
Okay, so Peter, what's the association's view from your membership? We'll be taking this leap of faith. What are your thoughts on it?
They absolutely will, and obviously as a membership organisation, we will support them in how they choose to practice within reasons. There's reason to everything. I'm personally really divided on it though, because I can completely understand why people are going private and saying, look, I can deliver a better level of service this way. I get a more appropriate fee. I can break the cross subsidy that is established from selling spectacles to delivering care, and I can completely get why people want to do that. At the same time, I am really concerned about what Colin was saying, though, about do we risk driving a massive health inequality where those with means and access to care in those circumstances get a better level of eye health, and actually those in disadvantaged communities who already have those disadvantages from their surroundings suddenly don't get the same level of care, and they may well have a greater need, less access already, and that doesn't sit particularly well with me, if I'm honest. I'm a healthcare professional. That's what I trained to do. I think that's what most of us train to do. That's how we see ourselves. So to not be delivering healthcare to those that might need it the most seems like a really difficult thing to sort of recommend. I completely accept that the GOS fee is a challenge, and I understand all of the arguments around that. I sit very close to a lot of it. It isn't an easy fix. I wish it was. If it was, we'd have done it by now, obviously. But so I think for now we will support our members in how they choose to practice. But I think all of us should be really mindful about the implications and the repercussions of some of those decisions and what it could mean for some of the most disadvantaged in our society.
Yeah, and before I come to Leonie, interestingly, we've got a comment from the audience about, and you can almost feel the pain in this comment, and it's kind of reflected in the way you spoke, Peter, about, we did not have a choice but to hand back our GOS contract. I refuse to let the service and the care I provide be compromised. And that's a painful statement for any healthcare practitioner to write, isn't it? But it's probably indicative of how squeezed they feel by that rock and a hard place dilemma, really. Leonie, thoughts on this? On this shift in some practices.
Thank you, Richard, and I totally concur with Peter's sentiments about the role that DOs and optometrists can play in reducing health inequalities, and the role that the vital part, that DOs and optometrists can play in delivering eye care services right across the United Kingdom. Something I was very aware of in steering through some of the changes that we've made to qualifications that we approve is some of the issues around access to services in our remote and rural parts of the United Kingdom. And I think that's very prescient, not just in the optical sector, but in other healthcare sectors too. But of course, whatever the profile or the cost basis of patient care, we as the regulator still expect registrants to comply with our standards and optical businesses to comply with the standards for businesses. But we are working really closely with Health Education England and DHSC on some of those sort of early moves around reducing healthcare inequalities and what might the role of the optical sector be within that sort of approach. We don't have an explicit obligation within our Act to reduce health inequalities or indeed around workforce supply and mapping workforce demand, but that has been discussed within regulatory reform, sort of some of the work that DHSC is doing at the moment. So, you know, I'm watching this space with interest, and it is that connection, I think, between, you know, the cost basis of service delivery and the relationship between that and fair and equitable access to optical services.
Yeah, you do wonder, don't you, if there's a way that we can kind of target the GOS money into those areas of greatest need, really, because that's where we'll get the biggest impact from it. Yeah. Alistair, move to go purely private, thoughts?
Well, I think if practices are no longer offering GOS services because it's not economically viable to do so, I think that is something we should be concerned about. And as others have said, I mean, it does create the risk that patients won't be able to access NHS care in certain parts of the country, which could well exacerbate existing health disparities. And I think there's an additional issue which is worth putting on the table, which is that it could lead to an increased risk of the variation of standards, because purely private practices won't be subject to the same NHS oversight, the same standards of clinical governance. And that's a risk that is increased by the fact that not all businesses currently have to register with the GOC, although I know that that's something that the GOC would very much like to address, and hopefully it will be addressed with the legislative reform that Leonie mentioned. But I think the NHS should really be monitoring very, very carefully the impact of practices handing back their contracts, and I think it really does add weight to the argument that GOS fees should be increased significantly.
Okay, and interesting, we've got a fantastic question from the audience. Do the panel look to the model in Scotland and see this as the right way forward to remove eye care inequality? So is the answer maybe, staring us in the face, or just over Hadrian's Wall, perhaps? I don't know. If any thoughts? I'll open it to the floor. Anybody got any thoughts about the Scottish model? Go for it, Pete.
So, I mean, I think most of our colleagues in Scotland and most of our colleagues in England would say that the Scottish model is a huge step in the right direction. We've got more universal access to care. We've got a higher fee. I think if you were to ask our Scottish colleagues, though, they would say that it hasn't necessarily kept pace with inflation and has been devalued slightly. So it's not quite as rosy as it may seem, and they've got similar and different challenges. I think anything that raises the level of care, the access of care, and enables practitioners to be less reliant on the sale of spectacles, because I think many of us think that is a challenge that will come with the sale of spectacles. We've spoken about AI. Where will that sit? Where will it go in the next 5, 10, 15 years, however long we're thinking about? Something that moves it more to a clinical care model, I think most of us would be exceptionally happy with. Whether Scotland has got it quite right yet, I think probably the jury is out. Maybe the fee needs to be a little bit higher. Maybe it needs slightly different services, but it's absolutely a step in the right direction.
And Colin, I guess, are we starting to get a sense that there's data and evidence coming out of the value in the Scottish model in terms of its, proven to be a good kind of bang for buck for the taxpayer?
Yeah, absolutely. I mean, I agree with Peter. I think it's great, but it's not probably as good as it could be. I think as clinicians, if we were rewarded for our clinical skills rather than having to cross-subsidise with sales of accessories and spectacles, then we would all be in a very happy place. But I think what it has done, and it's going back to what you've said earlier, I think it's helped some practitioners in Scotland work at the top of their license, hasn't it? Because they have been able to utilize the skills that they've trained for. So I think yes, it's a step in the right direction, and I think we do look on in England with some envy, and it would be nice to see some of that reflected in England in particular.
So we heard it here first. Scotland isn't quite utopia, but they've got it better than England. Yeah, it's great to have that insight, isn't it? Because it's been fascinating watching that journey of the Scottish GOS progression. And I think as you say, Colin, I think you'd be hard pressed to find many English-based optometrists who don't look upwards across the border with envious eyes, really. Okay. Moving on to the next question. Leonie's going to love this one. By Rebecca.
So it's come from an optometrist in Bristol. So in 2022, we moved from a CET framework to a CPD framework for UK eye care practitioners. a journey already completed by our Irish colleagues. For many, this has been too long coming, and for others, they have not got a clue what this means. So why is this the right thing, and how will it change lives for ECPs?
So, transition from CET to CPD. Peter.
I mean, this one really isn't my specialist subject, is it? I really feel Leonie should have gone first. However, I think where it could be brilliant is that for a long while we've had these boxes, these buckets of competencies that we've put people into and said, well, you've got to get these things, and that's a good thing because it maintains certain skills and makes certain that people can do the things that we need them to be able to do. What it fails to do, though, is recognise the additional skills that you may go out and gain that are completely relevant to your practice but don't neatly fit into one of those boxes. So this opens that up and means that if it's applicable and sensible and you can show that it's relevant, then you can get learning outcomes from it, you can get training points from it. I think that's a brilliant thing. I think probably the slight nervousness is how will practitioners understand this? Will they know what is and isn't out? And also, is there a risk that we do miss some of those core things, those boxes that I've just spoken about? Is there a chance that actually we neglect some of those a little because we're not forcing people to do them? It's really easy for us all to do the things we like. I mean, we could make a list as practitioners. What do you want to do? All retinal stuff, OCT, that sounds fun. Some people love BV, but for a lot of us, it might be all, actually, you know, I'm not as keen on going to that lecture. So I think there's a carefulness there that we have to be mindful of. But I think if it opens it up to bring in the other skills and the softer skills, perhaps, maybe things like, as an example, somebody said to me, well, what about if I go and do a sign language course? Could I get CPD for that? Well, that'd be brilliant for your patient care. You imagine the extra level of care you can deliver to your patients in that sort of setting. I think it's a great thing. And I think there's a huge amount of optimism, but just a mild note of caution, as you'd probably expect.
Yeah, absolutely. Thanks, Peter. So Leonie, I think Peter summed it up, hasn't he? There's a huge opportunity to liberate, but also there's a baby and bathwater thing going on, because the profession, people watching this event, you know, whatever people may feel about CET and what they've dealt with in the last few years, we've kind of all got used to it. We can navigate it. So, you know, what are your thoughts in terms of this transition, and how do we manage that risk and transition for the frontline practitioners and get them into this brave new world?
So it is a significant shift, Richard, and this is a journey. You know, in January we will transition from CET to CPD, but that's not the end point in this journey. There will be a 3-year cycle and then a further set of changes, which obviously we will develop and consult on, see feedback around for the next CET cycle, which will start in 3 years' time. And it's all about making our process for supporting registrants in the maintenance of their competence and the development of their professional skills to meet patients and public patient safety needs within the sort of landscape that we've described earlier, you know, that is changing rapidly. And it's what we're trying to do is put in place a system for continuing professional development that is more flexible and far less prescriptive, and really importantly, far more aligned with other healthcare professionals. Even that change of terminology from CET, which no one outside optics really understands. I certainly didn't. But CPD, you know, is readily understood, and as Peter has described, it will allow registrants to undertake, you know, learning and development which is really relevant to their own personal scope of practice, to maintain safety and quality of patient care. The element of accountability that sits within the new system is around the reflective exercise. So that's how we're, you know, anticipating the risks in the new system will be managed, moving from that tick box system to the more flexible, less prescriptive system. And so what we're doing is we're asking registrants to carry out that reflective exercise with a peer, and you know, we give guidance on what that peer, who that peer might be, and that reflective exercise must be centered around the registrant's own personal development plan. So in other words, what you're setting out to achieve at the beginning of your 3-year cycle, and then where you hope to be and where you get to at the end of that 3-year cycle, and your own personal investment of time and energy and potentially your own funds in your continuing professional development, and that sort of level of accountability that registrants will will have it in that reflective exercise, which obviously they will need to document and to upload onto our new my CPD portal, will give us, that level of assurance that we need, that registrants are reflecting on their practice and they are tailoring their CPD appropriately to their own learning and development needs. And I think the second, if you like, important development is that shift from the standards, from the competencies that underpin our current sort of qualification approval system, which is the baseline standard for entry to the profession, moving to using the standards for practice as if you like, the organising principle that sits behind CPD is really critical, and it sets out much better, I think, for us as a regulator and for the profession, the expectations of a profession in practice, and will help registrants organise and think about more critically their own personal and professional development. The self-directed CPD element as well, I think, is going to be really important. So, no longer do registrants have to constrain their CET activity to pre-approved CPD. Self-directed CPD will give registrants an opportunity to exercise that professional judgment in the selection of their CPD and in their reflection on whether that was effective or not. So we're moving from that tick box approach to something which far better reflects, I think, the maturity of the profession and where the profession needs to go in order to be able to address satisfactory challenges ahead.
And for those who are out there and are anxious, do you want to just say a few words about what like the portal will look like? Because I know there's been a lot of work done by the education team for that to be evolution, not revolution. People are going to recognise what they land on when they're with points, aren't they?
Absolutely. So it looks remarkably similar to what we have at the moment, but some of the elements within that are different. We have information on our website if registrants would like to go to our website to have a look at that. And indeed, we're running a webinar shortly, which registrants can sign up to. And in that webinar, we're going to give a quick demo of the new site. So I would urge registrants to sign up. I think that's 5 p.m. next.
It is. It's a week
Tuesday.
tonight. It's next Tuesday. Next Tuesday evening's fun and games.
Absolutely. So
yeah.
I didn't realise this was going to be a sales plug, but if you are anxious or curious, sign up and have a look.
And I know the audience may be a self-selecting group here, but there's some stuff coming through on the feed that's really supportive about the change. So comment about, maybe I'm being overly simplistic, but CET is about minimum standards. CPD should inspire us to be the best we can be. So, the people are getting it. CET, nobody else uses it. CPD is universal. The change is long overdue. So there's people feeding it back that this is that they get it. Alistair, from an Abdo perspective.
Oh, thanks, Richard. Yes, I agree with those audience members who fed in their thoughts. CPD, definitely the right thing to do, the right system to move to. And we've talked a lot this evening about the importance of enabling practitioners, dispensing opticians and optometrists to use their professional judgment when they're treating patients. I think let's trust practitioners to also use their judgment about what's the right kind of professional development activity to undertake. And so I think, in short, Abdo very much welcomes this change. It does bring DOs and optometrists in line with other healthcare professions, colleagues overseas. I think it encourages more interprofessional learning, which is really important. The more people are working with colleagues from other healthcare professions. And I think this is an important point to make, really. I think it will encourage, hopefully, more practitioners to become involved in lecturing, tutoring, because they'll be able to gain credit for this kind of activity in a way that they haven't in the past. But as others have said already, it is a culture change, and I think that's where hopefully Abdo can play an important role, in really supporting members in making the change. Something we've already been doing actually over the last couple of years. We've developed a professional development toolbox for members to use, and we're going to be holding sessions to help members plan their CPD for the 3-year cycle, and also facilitating discussions about how they can reflect on their learning and get the most from it. And I suppose there's the ongoing activity just to provide a really good range of CPD as we have done over the years, really to encourage all members to fulfill their potential, taking into account that people, they learn in different ways, they have preferred ways of learning and a diverse range of interests. So yes, very much welcome the change, and we'll be supporting members to really embrace it.
Thank you, Walter, because it is going to be quite liberating, isn't it? We're not boxed into a retrospective bunch of core competencies with this brave new world. It will allow people to tailor their development to their particular form of practice, which is, people are talking on the chat about, the pace of change is going to increase, and this feels like it locks into that pace of change. If we're going to change and embrace, different evolving roles, our learning development has to mesh with that really quite tightly, and we've got to embrace that and feel liberated by it. Colin, from a college perspective, I guess this is right up your street, isn't it?
Yeah, I mean, absolutely. We really welcome this as a good change for the whole of the profession. I think it's going to give optometrists and dispensing opticians much more control over their learning and their development, and it's going to be much less prescriptive than and I think helping registrants to develop the skills and tailor it to their particular scope of practice, which I think is really important, because if we kind of look at the way things have developed, there are some practitioners that practice in a very particular way, and I think this is going to be a really great thing. And I think there's some really nice touches in it as well. If we think about practitioners being really busy and sometimes pushed for time to try and find the slots to do it, if you can get a half point for a half an hour session, that's going to be a great thing. You could maybe dip into at lunchtime and do something around then. So I think it's going to be really great from that perspective. I think from a college perspective, we have a lot of learning materials on our platforms, and we're going to be looking at converting some of the stuff that we've got already to CPD. We're going to be developing new materials that will help and support practitioners, align it to our higher qualifications, really to help develop skills in that area. We're going to provide sessions and help on that reflective element that Leonie mentioned, because I think that's going to be very important as well for practitioners to really learn how to deal with that. And just from a personal perspective, something that I think is really great, those Friday afternoon ophthalmology teaching sessions that I go to, I can use those as part of my CPD as well, which is fantastic. So yeah, we really welcome it.
It's interesting because on the chat we had a comment earlier about what are the professional bodies going to do to be aligned and encouraging this. I think you've answered that question. I mean, that was a consistent view about everybody is lined up about encouraging practitioners to kind of run towards this change. Interesting, we also had a comment from the audience, which I think plays to your point, Colin, about the way we as a profession now perceive, probably post-pandemic, because of everything we've had to step into. We've had to keep the elevated position that optometry is now held in many secondary care practitioners. So we're getting a breakthrough here. Secondary care practitioners are now seeing us in a different light. And it does all say there's more we can do though. So yeah, we are starting to make some breakthroughs into secondary care to earn the respect, which I guess is the foundation stone on us then growing our professional positions. Good stuff. Right. Question number 5 from Simon Jones at the Optician magazine.
So the GOC recently announced illegal practice consultations, and the AOP launched a public awareness drive on the same issue. But can online contact lens retail ever be regulated properly in the UK?
Right. So, well, we've got to start at the GOC. Leonie.
Well, thank you. So yes, we have launched a consultation on a revised approach to illegal practice. I would urge everyone on this call to read those proposals and to provide evidence of impact of our proposed revised approach. That consultation closes on the 19th of January, so please go to our consultation hub. And our current approach is obviously very reactive to complaints received, and what we want to do is be far more proactive in our approach to illegal practice and to provide more clarity on when we'll take action and what action we will take. Online contact sales have always been a really difficult area for the GOC to regulate, even more so if a company is based outside the UK. As you know, everyone in this call will realise, we can do very little because we don't have jurisdiction outside of the UK courts. But what we would like to do, and what our consultation document sets out, is that we'd like to be far more collaborative as a sector to prevent illegal practice from occurring, and to get the best possible outcome really for patients and the public.
Thanks, Leonie. Alistair, what are your thoughts on this one?
Yeah, so the question is about whether online contact lens sales can ever be regulated properly. I think it really depends on what you mean by regulation. I think if you mean traditional enforcement action that involves prosecuting suppliers that don't obey the law, I think the answer is no, because as Leonie says, suppliers who operate overseas are not subject to UK law. I mean, looking at the consultation document, you know, I understand the idea of being more proactive in building relationships with online platforms, and presumably that means people like Amazon or eBay. And I think that that's certainly welcome, and I think would help to, you know, address issues like the supply of children's spectacles online, or, you know, the supply of cosmetic contact lenses. So, you know, that in those two cases, they shouldn't be sold online at all. But I think, you know, the consultation doesn't really address the supply of prescription contact lenses by overseas suppliers who don't require customers to have an up-to-date prescription, you know, who don't really care whether customers have had proper aftercare. So I think I would be looking for the GOC to go a bit further and think more creatively about you know, the kind of approach to regulation that would actually help address that issue. And I think one thing that would be worth looking at is the online code of practice that the GOC worked with the sector to develop a number of years ago. And you know, that could usefully be updated and introduced. And the idea behind that was that you know, it would be a way of encouraging contact lens wearers who want to buy their lenses online to do so from websites that are badged as following good practice. So you steer patients towards the suppliers that will ensure that they are able to wear contact lenses safely. And I think, you know, using consumer or patient information, you know, it's quite a common regulatory tool. It's used in other sectors. And I think that this is, you know, something that I think I would certainly encourage the GOC to look at. And it's not something for the GOC to do alone. I think it requires, you know, action across the whole sector, including working with contact lens manufacturers. But I think we want patients to, you know, some people will want to buy online. We want them to do so in an informed way and not inadvertently suffer harm.
Thanks, Alistair. And we've got a question from the audience about, you know, ABDO and the BCLA recently launched a reporting process about illegal sales of contact lenses. What's the update on that particular work stream?
Well, I think it comes back to the issue of evidence, and I think it's, you know, introducing ways of actually gathering evidence about the harm that can result if lenses are not worn safely. You know, that's all useful in making the case for you know, this to be prioritised as an issue that should be addressed.
But I guess you would encourage members that if they come across things that are patently illegal, such as, you know, online sale of cosmetic lenses, just encourage them to bring that to your attention, because that helps to bring the evidence base of risk, I guess. Would that be a message that you would want to send out?
Yeah, absolutely. Yeah, that's absolutely right, Richard.
Yeah. And I guess, you know, Alistair, you know, you and I have looked at some of this stuff in the past. I suppose where we are between that kind of aspirational goal of effectively regulating, whatever that might look like, and I guess where we are currently with an act that was written before the internet was a twinkle in somebody's eye, there's a whole gap of a range of stuff that can move us towards a more customer-centric and safer way of operating between those 2 points, really, isn't it? Between where we are and where we ultimately might want to get. There's a heck of a lot of steps that could be taken, I suppose.
Yeah, but I don't really think this is about necessarily changing legislation, because I think, as I've said, enforcing the law, you know, is only one part of this. I think it does require a more creative approach, which is not just the GOC's job. I think it's a job for the sector as a whole.
Thanks, Alistair. Colin.
Yeah, thanks, Richard. I think it's a really interesting point, and I suppose over the course of the pandemic, we may have seen more patients driven to online sales, just through the fact of not being able to access the practitioners or access, and they just see online as much more convenient for them. I think, picking up on Alistair's point, I think as a sector there is a lot more that we can do to educate the public around the risks of these sort of online purchases. There's nothing worse as a practitioner when a patient comes in and you ask them what they're wearing, and it's nothing like the specification that they've been issued last time round. So, I think practitioners, suppliers, manufacturers really trying to educate the public around these kind of risks is a really important thing. And I know we've kind of touched on earlier the Opticians Act review, whether there is scope within that to think about increasing the jurisdiction that the GOC has over these retailers that are based outside the UK, because it is a risk, and it is potentially something that can impact on patient safety. So I think that there are a few things we can do short term as a sector, start educating the public, but looking forward to that consultation, is there more that can be done in future?
Yeah, as you say, we're not hostages to fortune here, are we? We do have, at some point in the journey, we will have somebody in our consulting room where we can make sure they understand what they need to be thinking about in terms of their future supply. Peter.
Thank you, Richard. So, as you know, we've called the question referenced our campaign, and we've called for sort of the loophole to be closed. And I'm mindful that obviously the GOC can't regulate for those companies that sit outside of the UK, but there are some companies that sit there and actually actively redirect people from a UK-based site to an overseas site to sort of circumnavigate the rules, which, whilst we may not be able to regulate the overseas company, it feels like we should be able to do something about the company that's willfully seeking to get round the rules, and that would be something we'd be really keen to do. And we've spoken about a kite mark and things as well, which I think is an important thing, very similar to, in reality, what Alistair's already discussed, that sort of assurance that you're getting a quality product, a safe product, and the person providing it knows what they're doing. I think one of the big bugbears as well for the profession, though, is not actually illegal contact lens supply. It's legal, but it's around substitution. And Colin sort of touched on it briefly then as well, about patients that come in wearing something that you haven't given them the specification for. You've spent a lot of time making sure the lens is appropriate, the specifications of the lens, the properties of the lens, how that patient is going to use it, and it may have all the bells and whistles of coatings and oxygen transmissibility and a certain modulus, and then they go online, and some companies that are acting within the rules substitute 100 different lenses for one or two lenses within their product range and say, well, it's done under direction, so it's okay, it's within the rules. I'd really like to see somebody really take that issue on as well. It's not illegal practice. It doesn't technically fall under this, but it's a big problem for the profession and still a big safety risk for patients if it's allowed to go unchecked.
Okay, thanks, Peter. So, if people share your view, and I'm sure many listening do, that the door is open to the GOC consultation, 19th of January. Leonie told you, so you have it within your grasp to feedback thoughts and evidence on those particular issues. Thanks, Peter. Okay, final question. So,
from a dispensing optician in Glasgow, the UK has just played host to COP26, an event that sharply put the need to manage climate change and our environment more responsibly. We know Abdo have also placed a spotlight on this topic within the optical sector. What should be the optical sustainability agenda, bearing in mind that we are a medical profession and not everything is as straightforward as we might like it to be?
So there's the understatement of the night. Not everything is as straightforward as we might like it to be. Yes, I recognise that. So, sustainability. Great that we have a Glasgow dispensing optician mentioning this. They've hosted COP26. We're at the heart of this. It's a global initiative. What's optics' position going to be in it, Alistair?
Well, thank you, Richard. I mean, I would say probably nothing's as straightforward as we might like it to be, but I think in relation to this issue, I think we all have a responsibility to try to operate more sustainably, particularly by reducing our carbon footprint and reducing plastic waste. And I think the summit that ABDO held in November, working with colleagues across the sector and also optical suppliers, I think that highlighted some really good initiatives from across the sector. And it was also an opportunity to launch the self-assessment tool that we've developed, so practices can actually gauge how well they're doing and find ways of operating more sustainably, and identifying some easy quick wins as well as things that will take a bit longer. I think the idea that we're a medical profession and therefore a bit different or exempt, I think that's a bit of a red herring. I think all suppliers and practices can look at their operations and find ways of reducing their carbon footprint, whether that's reducing emissions from heating and vehicles, reducing electricity usage, choosing renewable energy suppliers, reducing waste, and also looking at travel, the way that their staff get to work, and business travel. And I think as well, practices can challenge their suppliers and ask them, what they're doing to operate more sustainably, whether they're suppliers of frames, lenses, or accessories. And I think really we all need to do our bit. If we're going to have any chance of keeping the rise in global temperature to 1.5 degrees, and that means reducing emissions and then offsetting those that we can't remove immediately. So I think lots we can do, and it's easy to see this as really daunting and overwhelming. But I think hopefully some of the resources that we've developed, there's a lot of information on our website, that will be of support to practices and practitioners as they look at how they can engage with this very important agenda.
And Alistair, are you getting a sense from members that they are starting to get consumer pressure in this area? Yeah, are consumers starting to talk about this when they come into practice?
Yeah, I think that's certainly one of the drivers for change, and that leads practices to then look at the kind of ranges of frames they stock, and the way in which the lenses they sell are actually made. So I think that is another important form of or a driver for change. Certainly, yes.
Yeah, good. Colin.
Yeah, it certainly is a challenge, isn't it? But I think we do have a responsibility really to try and improve our optical sustainability and our impact on the environment. And Alistair's already alluded to it. The college did work with ABDO on their social, ethical and environmental initiative, and that sustainability self-assessment tool that you mentioned, I think that can provide optometrists and practices with clear practical changes that they can utilize to help make a difference, and there are things that we can do to straight away. I mean, the college itself, we're already taking steps there to reduce our carbon footprint. So we've introduced hybrid working, paperless offices, and I think increasing members' awareness of sustainable causes and schemes through a series of articles that we publish in Acuity, and our guidance for professional practice, which was quite a hefty tome, is now an online version only, so we don't print that anymore. And I think things like with our public-facing website, Look After Your Eyes, we're giving information to the public on schemes for recycling contact lenses, for example. So I think we can all do our bit, but as I've said, it is a challenge.
Yeah, thanks, Colin. Interesting chat coming through from the audience. Actually, where we started, tele-optometry is one of the ways we can reduce carbon emissions. Interesting comment from a practitioner. I don't think a clinic goes by without a patient asking me about sustainability in some way or other. So in answer to my question, it's clearly live. And this is another topic where we're required to accept and make changes. Change is sometimes uncomfortable, but inevitable. And I think if you link that to the comment that, not a clinic goes by without somebody asking me about it, the pressure is going to come raging towards us in a torrent now about the public, and now consumers are clearly engaged with this issue. Peter, from an association perspective.
So I think first of all, I'd like to just commend ABDO for making a really good start on the journey that the sector needs to take on this. I think they need some praise for that, because I think it's a good thing that they've done, sort of kicking this conversation off, because I think a lot of us probably hadn't prioritised it enough, and it's really useful to have a spotlight shone on it. So that's a really important thing. We are having lots of discussions internally about this, and I think we will be pushing out with a number of ideas going forwards next year. The medical profession bit, I think, is misleading, though, as Alistair said, and I think Colin touched on it as well. Some of the things we will not be able to fix, because we will need disposable items, we will need single-use items from a clinical perspective, and everybody accepts that. However, there are lots and lots of easy wins, sort of simple wins. We all get incredibly frustrated. We all shop online. Something turns up, it's a box in a box, with plastic packaging and wrap around it. It's looking at those things, the fairly simple things within a practice setting, and saying, you know what, where don't I need to do that? Where can I change this? Where can I do this just in a slightly different way? And I think if we all make those steps and all make those efforts, we'll make a big dent in it. I mean, some of the sort of bigger things I've seen people doing, switching home visiting fleets to electric cars, or starting to switch them over. Lots of short, often local journeys between patients' houses, actually not that far flung. Perfect for an electric vehicle, no pollutants and all sorts. So I think there's things we can do. There are cost implications for some of it, but we shouldn't let the fact that some of it's difficult prevent us from doing the things that we can do. I think that's got to be the message.
Fantastic. Thanks, Pete. Leonie.
And yes, Peter, I absolutely echo your praise of ABDO and the sort of the call to apply, really clear leadership here. What COP26 has done, and isn't it great to see, the UK leading on these issues, is really create a sense of urgency for action for all of us as individuals and for those of us who are in leadership positions as well. As consumers, as has been mentioned, we all exert a direct influence over our purchasing decisions that has an impact in relation to our planet, and the same is for purchases of optical appliances. Then as employees or as employers, we have an obligation in our employment practices and the way we organise our resources to safeguard our planet for our children and our grandchildren. So all of the issues that have been discussed, and I think that the professional associations, membership bodies are leading on, so travel, accommodation, recycling, packaging, etc. What's much more difficult, and what I don't have an answer for, is what the role for the GOC should be within this debate as a regulator. And this is something that all healthcare regulators are grappling with at the moment. So what does this urgency mean for us in the way we regulate, and what influence should we exert on our registrants in order to generate that change of behaviour, that change of practice that's required. So I don't have any answers, but what I do know is that next year we're launching a review of our standards for registrants and a review of our guidance. And I think we'll be really keen to hear from the sector, from registrants and from professional bodies about whether sustainability and regulatory intervention on this issue should form part of our standards moving forward, and whether that is a lever that we should deploy, or whether there are other ways that we can achieve change given the urgency that's required.
Brilliant. Thanks, Leonie. I think, it's there's a question just come in that I'm going to read out, and then I'll let you have a think about. So, what is the most recent sustainability-based decision that each member of the panel has made? So, we'll stick with the batting order we had. So, Alistair, what's the most recent sustainability-based decision? I don't think it means you personally. I'm assuming it means your organisation, but you can answer that in whichever way you see fit.
Well, I think I would think back to a meeting I had yesterday. I've been doing work on this issue with our Antonia Chitty, our head of communications, who really took the lead in organising the C Summit, and we've been talking to companies that might be able to help us in conducting a carbon audit, so that we've got a benchmark for Abdo's carbon footprint, so we can then look at how we can reduce that over time. So I think deciding to actually go ahead with that, I mean, that's something we're going to be hopefully doing in the new year, and getting support then in how we can actually improve things.
Thank you. Colin, follow that. Yeah, you just said we put our professional standards online. Crikey, you've saved an Amazonian rainforest in doing that.
Well, absolutely. Well, I was going to take it as a personal thing and think I've just clicked the heating down a little bit. But no, I, in all honesty, with our council meetings, what we're looking to do going forward is, rather than flying people down from Scotland, we're thinking about the hybrid way of organising our meetings. So our meeting rooms in the college we've set up so that we can do this kind of thing. People can dial in. The technology is so good now that you can take an hour or two out of your clinic, join the meeting, and you haven't had that huge carbon footprint with your flight from one of the nations. So that's the kind of thing we've been thinking about doing and will be implementing as we go forward into the new year.
Thank you, Peter.
I mean, very similar themes, really. We have gone to a hybrid style of working where possible, trying to get those short meetings to be sort of online or at least hybrid for those that needed to travel previously, and avoiding that sort of 3 hours on a train or 2 hours on a plane for an hour and a half meeting. So we've done that, and we've looked at going paperless as much as is physically possible, and we're aiming to get that down to almost zero. On a personal level, I bought an electric car, so I mean that's pretty good. My travel now is to and from a train station most of the time, short journeys, a cold engine, so an electric car made perfect sense for exactly that reason, and also because I'm quite tight and it's a little bit cheaper to run. But I mean that's a separate issue.
Actually, I had your motivation down as a speed freak. I thought it was the 0 to 60 in 3.5 seconds that you were probably going for. Leonie.
Oh, thank you, Richard. So we too at GOC have established a sustainability committee chaired by one of our managers, looking at the ways that we can occupy our building in a more sustainable way and discharge our statutory responsibilities more sustainably. Much of the same discussions that have been illustrated here this evening. And I personally take much joy in cycling to the office, and my small personal contribution, I suppose, is about encouraging other colleagues to do the same, even when it's wet and windy and you arrive a little bedraggled. It's still quite exhilarating, and I know I've freed up a space on the bus for somebody else, and I haven't negatively impacted in terms of our planet's resources.
Fantastic, thanks, Leonie. So I'm conscious of time, but what I'd like to do is just before I kind of wrap things up, I just want to ask the panel, because we've covered a lot of ground tonight. As we approach the end of 2021, and it's been, crikey, yet another tumultuous year, and heaven knows what 2022 is going to bring. What's your key message for the people who have tuned into this event this evening as we kind of head towards 2022? So Leonie, I'll start with a regulatory perspective. Newly appointed chief exec. What's the message for the future?
It's about putting patients front and centre in our regulatory activity. I think that's about discharging our regulatory responsibilities brilliantly and absolutely prioritising patient care within that. There are a number of really key strategic moves that we're making over the next 24 months. We've discussed the shift from CET to CPD, but also some really key moves in education, in the way we train our future professionals, and in the way we take action against when things go wrong. And I think it's about putting patients front and centre. And for me, it's about the really positive contribution that a well-regulated profession can make to patient safety and to some of those really big key issues around the healthcare of the nation, that the profession has some very positive contributions to make. And we as the regulator have a small part to play in that, and we want to play it really well.
Thanks, Leonie. Alistair?
I think over the last year or 2 years even, I think dispensing opticians have really demonstrated the valuable role they play in delivering eye care to patients. And I think over the next year, CPD will be a big change, as we've discussed. And I think we want to support members to really have the most fulfilling careers that they can. And I think from an ABDO point of view, also looking to raise awareness of the roles that the members carry out with employers, with commissioners, and also with other healthcare professionals. So I think that's something that will certainly be a priority for ABDO.
Brilliant. Thanks, Alistair. Colin.
Yeah, thanks, Richard. And, I think if we reflect back, I think a lot of our members have worked incredibly hard throughout the pandemic. They've provided great eye care to their patients, and I think sometimes it has been a bit stressful, and I know some of our members have got a bit frazzled with the pressures that they've been working under. I would like to say if you can have a good break over Christmas, but I know some practices are still incredibly busy and are going to still be under pressure to see patients. But I think moving forward, what we'd like to see is the skills of all optometrists recognised, particularly those with higher qualifications that can maybe utilise those in a better way with new ways of working, and hopefully we'll be looking at new pathways that those can be integrated into.
Thanks, Colin. Peter.
Yeah, I'm going to sound like I'm saying the same thing, I think, to most of the others, but we're going to see some changes, as we've said, potentially in regulation. We're going to see some changes in the structure of the NHS with the emergence of ICBs and ICSs, depending on how you're looking at them. We've got a huge backlog. There are patients losing sight because they cannot be seen within the secondary care environment. There just isn't the space for them. The waiting list is too long. So I really want to see us push into that space, make certain that we are looking after patients, and that as soon as somebody thinks they have an eye problem, that they come into an optical practice and see their optometrist or their dispensing optician, dependent upon what the condition is that they're presenting for. And it is about that overlap, utilising the skills of everybody, and interprofessional working, the networks that were set up within queues of referring to an IP when you needed to, rather than thinking that everyone has to be IP, utilising the skills that you've got on hand around you. I think that's going to be absolutely crucial if we're going to solve some of the challenges that we've got.
Brilliant. Thanks all. Also, look, fascinating. I mean, the time races by doing this. First of all, I want to thank the panel for their contributions and their thoughtful interventions into tonight's discussion. I think events like this are just really important to help stimulate the audience to think, differently about our future. And I think there's been a really consistent, positive message about embracing change that's come from all of you. And I think that's exactly what this event has to be about. It's a chance to reflect on the previous year, but really set ourselves up right in the right frame of mind to embrace the future. And I'm hugely grateful for all of you investing your time and energy in that this evening. I also want to thank Rebecca and the team at Alcon for hosting this evening's event. It's become a part of the optics calendar, and I think it's just really important, as I say, because it allows people to take a moment to reflect and think. And finally, to the audience who are at home watching, a huge thank you for all you do looking after the nation's eye care, but for tuning in tonight to be part of thinking differently about creating a new future. And on that note, I mean, Leonin's mentioned it, the GOC have got a consultation open till the 19th of January. We don't have to be, hostage to fortune. We can shape our future. And, not just with this GOC consultation, with every other, consultation the GOC do, we can be part of that change. So please embrace it. And, as they say, we'll get out of it what we put in. So thank you all, and good evening.